Hi, I'm Dr. Usha M Kumar here. So this is the biggest myth that patients they have completed their family, they have finished their periods, so and they started having spotting or bleeding PV. And most of the time they think that could be a sign of an uterine cancer. It is true, but not for all patients. 90% of the patient, the bleeding is not because of uterine cancer. It is normal bleeding because with age your ovaries are also aging and they stop making egg. So there is one hormone we call it estrogen. It's there, but the progesterone is not there, which is controlling the bleeding. So that's why you can have bleeding. And just to tell you, 90% of the time it could be just physiological bleeding. Of course, we can't ignore the 10% possibility also for uterine cancer. For that, you must visit to your gynecologist, and we usually advise simple tests like ultrasound, which is the transvaginal sonography, just to check exactly the thickness of endometrial lining or the lining of your inner lining of the uterus. So if it is more than the cutoff point, we do advise you to go ahead for endometrial biopsy, which is a very simple test, and hardly you have to be you have this procedure hardly 5 to 10 minutes of procedure, and most of the time we can take the biopsy as an OPD basis as well. So but in few patients, like if the mouth of the uterus is not loose enough, we can ask them to get admitted in the hospital, and there is a small telescope, we call it hysteroscope. Through that we see the suspicious area and we take the biopsy. So that is the best biopsy actually, because we can directly see the lesion, and there is no cut involved. So we just to be you have to be anesthetized hardly for 15-20 minutes. It's a small procedure and you must do it, because this is the only confirmative test whether you have uterus cancer or not. Thank you so much for the listening.